We're looking at a blanket of snow covering the Big Apple as New Yorkers endure yet another bitter winter blast, as much of the country grapples with frigid temperatures and widespread power outages. Good evening, I'm CHRISTINEPERSICHETTE. We'll have more on the extreme weather conditions affecting more than 100 million Americans in just a minute, but first, the freezing temperatures and piles of snow aren't cooling things down for Governor Andrew Cuomo, as reports of bullying surface and calls for multiple investigations into the nursing home debacle continue to mount. Currents News' Emily Drooby reports.
The FBI and U.S. Attorney's Office in Brooklyn are investigating how Governor Andrew Cuomo's administration handled data on the state's COVID nursing home deaths. Now Democratic leaders from the state Senate are moving to strip Cuomo of his pandemic emergency powers, many angered by the state withholding death toll numbers.
What they've been doing is they've been stonewalling us on data for months.
Assemblyman Ron Kim of Queens claims the governor threatened him and demanded he immediately put out a statement of support. This coming after a leaked conference call where a top Cuomo aide admitted to withholding that data out of fear it would be used against them by federal prosecutors in the Trump administration. For months, Kim has condemned Cuomo's handling of the nursing home situation.
He asked me to lie to cover up for his staff. He's been biting his tongue, but he will go out tomorrow and destroy my political career.
An advisor to the governor claims Kim is lying about the conversation, but on Thursday, New York City Mayor Bill de Blasio backed Kim.
I believe Ron Kim. First of all, you can just see by what he's saying, it's from the heart, and it was a very painful experience for him.
Well, earlier this week, Cuomo took responsibility for not providing that information sooner.
The void we created allowed disinformation.
Still, pressure is mounting against Cuomo. Senator Ted Cruz, along with other Republican lawmakers, now urging the Senate Judiciary Committee to open an investigation. Emily Drooby, Currents News.
The nasty weather and vaccine shortages are delaying 2 New York vaccine sites. Locations at Martin Van Buren High School in Queens and Empire Outlets on Staten Island were supposed to open today. Mayor Bill de Blasio is blaming disruptions in the supply chain.
This is a real problem. We've lost a couple of days in terms of vaccine supply. We are hopeful that by tomorrow our supply will be replenished and we can get back on track. But as everyone knows, 35,000 appointments had to be held back. Never like doing that. We don't want to do that. We need supply.
The mayor's office says other vaccination sites are open today. Warming centers are open across Texas amid frigid temperatures and rolling power outages. Right now, about 500,000 people are still without power. Most of the state has been below freezing for the past few days. In Plano, the Grace Church is open to residents, but they must follow COVID-19 protocols. And in Austin, power in some areas may not come back until Tuesday. In Corpus Christi, the American Bank Center is open to Texans trying to escape the bitter cold. The center was so overwhelmed they had to shuttle some people to a nearby FEMA facility. The center is offering meals and personal protection equipment to those seeking shelter. The weather is delaying vaccination shipments all over the country. Here in New York, some of the city's most vulnerable populations are slowly getting vaccinated. And Catholic Charities Brooklyn and Queens has been there every step of the way. Currents News' Emily Drooby traveled to Long Island City last week to report on this very important outreach.
It's a big day for Maria and her son and caretaker Adrian. After living in fear for almost a year,
scared in the beginning because nobody knew anything about the virus.
They got their second COVID-19 vaccinations.
We made it through.
Inoculated, and they have a familiar face in the Diocese of Brooklyn to thank.
Because of them, the Catholic Charities, we had this opportunity.
Catholic Charities Brooklyn and Queens, through a partnership with the Floating Hospital, they've been vaccinating seniors from the residences and senior centers along with some caretakers, getting them highly sought after appointments, even transporting them there. 77 people have gotten their first round. A very important service, as Richard SLIZESKI of Catholic Charities Brooklyn and Queens explains, especially for the city's older population.
There's so much anxiety out in the community, And one of our biggest goals was working particularly with our most vulnerable in a population that we work with. Seniors were on top of the list.
According to the CDC, about 80% of COVID-related deaths have been in people over the age of 65. Moments like this providing hope.
It's a game changer for people. When you have the vaccine, it puts you in a different place.
It's pretty exciting. It's great for staff, of course, when we started doing vaccinations to know that there was potentially some relief on the horizon. But it's even better to see patients coming back in, having tolerated the vaccine pretty well, and just their excitement.
Catholic Charities will continue to give their seniors a shot at good health. They'll be bringing people here for the foreseeable future. They've got more scheduled for this week. In Long Island City, Emily Drooby, Currents News.
Vatican City has a message to employees: no vaccine, no job. The city-state's governor issuing a decree for everyone working for the Vatican to get a COVID-19 vaccination. The decree is intended to protect employees and cites Pope Francis's advisors who say there is a moral responsibility to get vaccinated. The Holy Father has received the shot. Vatican employees with legitimate health concerns may be exempt. As COVID news continues to change daily, new questions are piling up about the virus and vaccines. A big one right now: will the shots work against the new COVID variants? Infectious disease expert Dr. Robert Tabali gave me the answer for the two most common variants on Wednesday, the British and South African variants.
The British variant appears to be much more infectious, likely because it causes more virus in the mouth and nose. And Britain has published information that appears that it's slightly more a stronger disease causer, about 30% more serious illness with the British variant than the, if I can call it, the traditional variant that we kind of understand. The South African variant has a different surface protein, the spike protein, and so the vaccines that we're giving today are not going to be as effective against the South African variant.
The good news, though, from Dr. Tabali is that vaccine manufacturers are working to make vaccines specifically for the COVID variants. We'll talk with him more later in this newscast. Democrats are set to announce a sweeping immigration bill. It offers an 8-year path to citizenship for most of the 11 million undocumented immigrants living in the U.S. Exemptions are offered for farm workers, migrants here for humanitarian reasons, and who were brought here as children. President Joe Biden hinted he's fine with splitting the bill up into a few pieces.
Had a refugee bill by itself? I'm not suggesting that, but there's things that I would deal by itself, but not at the expense of saying I'm never going to do the other. There is a reasonable path to citizenship.
The president faces a tough uphill battle from Republicans in Congress to get everything passed. There's a lot more news headed your way. Concerns over the vaccine continue to grow, especially in communities of color. Coming up, we'll tell you about the dark history contributing to the numbers and the efforts by the Catholic Health Association to battle racial bias associated with the coronavirus. Stay with us.
There are now some big changes to the tablet website. You can get personalized access to the Catholic news you value. Sign up for free at thetablet.org.
As we continue to honor Black History Month, we want to take you back in time to one of the most infamous bio-research studies in American medical history. Its effects on the African American community, many experts believe, is contributing to higher rates of COVID hospitalizations and deaths among Black Americans. Currents News' Jessica Easthope examines some of the reasons why.
It's a shameful and lasting legacy, decades in the making. The Tuskegee syphilis experiment, one of the most prominent, but certainly not the only example of unethical studies on people of color.
Historically, they have been vulnerable and taken advantage of in research and in science.
In 1932, hundreds of Black men with latent syphilis were lied to, lured into an ongoing government-led study with the promise of free health care. Instead, they were used and abused by medical professionals, never told about their diagnosis or treated, even after medicines had been discovered. So is it any wonder that today, in the midst of a global health crisis, there's a lack of trust that's proving deadly? Black Americans are dying at nearly 3 times the rate of white Americans, but only 38% of Black adults are likely to want the vaccine, when now nearly half of all American adults are on board.
In this case, with the pandemic,
Harlem Gunnis is the director of public health for St. John's University. He's studying the effects of the pandemic on communities of color.
throughout history, we're seeing similarities with the disparities of the infection. And we're also seeing disparity in its perceptions. So history is repeating itself over and over again.
That history has led to misconceptions and mistrust. It's known as the Tuskegee effect.
The vaccine has a chip, a microchip, where they can track you. The vaccine was made to get rid of our people. These are some of the perceptions that they're having.
This time around, government officials are determined to not let that happen again.
We just injected over close to 900,000 people. And if you go to the city and state and say, well, how many of them are black and brown? How many of them are New Yorkers? We have it, but it's on a hard form. That's unacceptable.
One way to combat those notions is with facts and information.
Okay.
Brooklyn Borough President Eric Adams joined city leaders in demanding a digital database that shows the disparities in vaccine access and distribution be created.
We should have been on the ground using incredible messengers, faith-based institutions, and saying, how should we be communicating to this constituency their reluctancy to take the vaccine.
Government officials across the world.
At St. Martin de Porres Parish in Bedford-Stuyvesant, Pastor Father Alonzo Cox feels responsible to make sure his parishioners are as informed as they need to be.
And I think if the vaccination is going to help slow the spread of, or even stop the spread of this virus, I think that would be the best interest for this parish community.
But the sins of the past still linger in the minds of many.
Sending you like lambs among wolves.
At St. Matthew's Parish in Crown Heights, Pastor Father Frank Black says his own skepticism is preventing him from telling his parishioners outright they need the vaccine.
I can't tell them to get it because I'm not sure if it's safe. All I can say is I'm going to take the chance and get it when I can.
The Tuskegee syphilis experiment left a lasting divide, but when it comes to closing the gap of health education and trust, there's no time like the present. Jessica Easthope, Currents News.
Examples like the Tuskegee experiment, just one of the reasons why it's so important to fight racial injustices within the medical community. Now, Catholic doctors are helping in that fight too. The Catholic Health Association announced an initiative at the beginning of February where healthcare groups pledge to make sure COVID-19 testing and vaccinations are equally available to minority communities. The CHA currently represents more than 2,200 hospitals, nursing homes, and long-term care facilities around the country. While some Americans question getting the vaccine, many are wondering which shot to go for, especially now that 2 vaccines are currently available and more are on the way. Back in January, Currents News' Michelle Powers reported on which vaccine is recommended by medical experts based on individual needs.
2 coronavirus vaccines currently have the green light in the U.S. The first is Pfizer's vaccine, 2 shots given 21 days apart. This one is recommended for anyone 16 years and older. The second is Moderna's vaccine, again 2 shots, but this one is given 28 days apart and is recommended for those 18 and over. Research is still being done to determine whether these vaccines are safe for children and younger teens. If you're pregnant, you can choose to get the vaccine, but you should know that these vaccines were not extensively studied in pregnant women, so there's limited safety data to look at for that group. On the other hand, COVID-19 itself poses a risk for pregnant women. The CDC says that some women who contract the virus are at an increased risk of severe illness and might also be at an increased risk of having a preterm birth. Both Pfizer and Moderna created mRNA vaccines, which aren't thought to be harmful for a nursing child, and that's according to the CDC. For those who are immunocompromised, you can choose to get the vaccine, but these shots weren't substantially studied for your underlying health conditions. So there's not enough data on how safe they are or how effective they are yet. On the other hand, getting infected with COVID-19 can be risky for people with compromised immune systems. For those with allergic reactions, the CDC says you shouldn't get the shot if you're allergic to the components in these vaccines, and you can review those on the vaccine's product labels. Michelle Powers, Current News.
Here in New York City, close to 1.4 million vaccine doses have been administered, but there are still many questions and fears about this virus. Answering more of those questions is Dr. Robert Tabali with the Catholic Medical Association. On Tuesday, I asked him another big question people have about the vaccine. How long does it take after the 2 shots until you build full immunity?
Well, that's very important to qualify exactly what quarantine means. And so after the first shot, about 30% of people get a significant boost in immunity. And then after the second shot, it's almost everyone has a very, very high and steep rise in immunity. The booster shot, very important. And so about 14 days after the second shot is when you have your maximum level of, immune take or immunity developed by the vaccine. So what that means is, at that point, until 4 months after you get the vaccine, if you're exposed to someone with COVID, that means you don't have to stay in your house for 10 to 14 days.
Okay.
That's what the quarantine means.
I want to ask you something quick, though, because you said up to 4 months. So what do you mean? After you get the 2 shots, up to 4 months, we don't really know what's going to happen after then?
Well, that's the last sentence in the CDC recommendation. So from 2 weeks after the vaccination for 4 months, because we know that immunity lasts for at least 4 months from these messenger RNA vaccines, but we don't know how much longer immunity will last. That information will be available in the months to come, but it's a window, 2 weeks to 4 months after the vaccine.
All right, some concerning news for parents from the CDC. It reports there are more than 2,000 cases of COVID-linked syndrome among children. It seems the number of cases are growing and they're more severe. What are your thoughts on that?
Well, this COVID-linked syndrome is actually the multi-system inflammatory syndrome that we were talking about earlier. Initially was most common among Hispanic and Black children. And it's very similar to something called Kawasaki's disease, almost indistinguishable in certain situations, but it can inflame the heart, inflame the blood vessels, cause organ issues, organ failure, respiratory failure. It's very serious. It's likely an immune response to the infection. And, we just don't know if the children that are getting them are having their first infection, their second, or their third infection with COVID, because many of them are asymptomatic. If this is a building immune issue, or if it's a strain-specific issue. But it is very concerning to parents all over the country, without question.
All right, right now the vaccines are only for people over the age of 16. Why is that, and will children eventually have to get the shot as well?
Well, they're trying to recruit children into studies right now. The initial studies did not include children, and that was because children seem to not have serious illness with a disease. And so they wanted to study as many people that would benefit mostly from the vaccine. So they're trying to recruit children into the vaccine studies now, and the vaccine manufacturers are having a great difficulty in getting children enrolled in the studies.
And that was, once again, infectious disease expert Dr. Robert Tabali. Still to come on Currents News, we'll take you back to 1947 when New York City faced a different infectious killer, far more deadly than the pandemic is today, smallpox, and what the Big Apple did to stop the spread in its tracks. Stay with us. Do you have a story idea or want to share a tip? Email us at newstips@desalesmedia.org or call our 24-hour number, 718-517-3122. We'll be right back. New York City was at the heart of the coronavirus pandemic when it began spreading across the country. But that wasn't the first time the Big Apple faced an infectious killer. Back in 1947, smallpox threatened the city, and the city fought back with one of the most ambitious and well-executed public health campaigns in its history. Could the lessons of the past inform the rocky vaccination efforts the city is experiencing today?
Please remember that it is only vaccination that is a protection from the dire ravages of this very serious disease that leaves in its trail death and destruction.
That was New York City Health Commissioner Israel Weinstein in 1947, urging all New Yorkers to get vaccinated after an American businessman contracted smallpox during a trip from Mexico and later died in a New York City hospital where others soon became infected.
In 1947, there was a small but scary outbreak of smallpox in New York City.
The scare launched a citywide scramble to keep New Yorkers safe from a deadly killer whose presence dates back 3,000 years. Infectious disease expert Kent Sepkowitz studies outbreaks past and present and says smallpox was an even bigger threat than COVID-19.
Smallpox was a much more fatal disease if acquired. And among survivors, it was quite disfiguring. Could lead to blindness and a lot of other problems.
Smallpox killed an estimated 300 million people in the first half of the 20th century alone. 30% of those who contracted the disease died, prompting the city to spring into full crisis mode.
It was bad enough that the mayor and the Department of Health both decided that the entire city had to be vaccinated. It was a city of about 7 million plus people at that time in 1947.
Tens of millions of doses were distributed, vaccinations were free, and a coordinated public education campaign helped spread the word. Archivist Katie Ehrlich with Municipal Archives works with the valuable remnants of New York's history that tells the story.
The vaccination programs that the city implemented, around the mid-20th century were really highly organized and kind of all hands on deck, setting up free health clinics, setting up points of contact where New Yorkers could go and get these vaccines, and it was really targeted to specific populations in terms of who the city thought was more perhaps vulnerable to these specific outbreaks.
Less than a month later, millions of New Yorkers had been vaccinated, and the public health emergency declared over. 4 to 5 million people in all, including part of the tri-state area, were vaccinated over a 2-month period.
It was something to be proud of. It was New York style. It wasn't, completely everyone behaving, but it was something that is a real achievement. And the success of it was that we were still really in a let's do this for America moment. We were very much in a taking orders is okay moment. That's how you get things done.
The 1947 smallpox scare marked the last major outbreak in the country, and even though only 12 people came down with the disease and 2 died, a massive global effort to vaccinate the entire world population soon followed. Smallpox was officially eradicated in 1980. And that is Currents News. I'm CHRISTINEPERSICHETTE. Thank you for joining us because we are putting your faith in the news. Stay warm and safe. Hope to see you again next time.